28 days, or should I just say 328 days since the lockdown here in South Africa, we now have the first inoculation against COVID-19 being administered. The shot is getting ready to be taken there, of course. Very important and significant news at a time when South Africa's COVID-19 cases, yes, daily rate is indeed declining, but over 1.5 million people now, around 1.5 million people have indeed contracted COVID-19, and the number of deaths continue to rise, of course. South Africa is hoping, of course, to get to a stage where it can at least receive a herd immunity, and that will require a number of people to then get vaccinated, of course, having seen so many issues with the jabs in recent times. There we have it. The first person to get inoculated in South Africa, the health workers there in Khayelitsha getting inoculated, the first vaccination against COVID-19 here in South Africa. My colleague Bulelani Philip standing by then with this. Bulelani, clearly a moment to savor, a moment of significance, and a moment of moving forward for South Africa here.
Definitely a moment to celebrate as the first vaccines are coming here at the Khayelitsha District Hospital, and of course the country's #1 citizen is taking the fight with him, taking the jab here today, signifying that he's got trust in the rollout of this vaccine. And of course the vaccine that will be administered here today is the Johnson & Johnson vaccine that has come from Belgium and arriving in the country last night. Here at the Khayelitsha District Hospital, it's going to be about 50 doses that will be administered here. Across the province, it's estimated about 13,000 doses will be administered over the next week or so. A short while ago, the Health Minister, Dr. Zwelithini Mkhize, as well as the Western Cape Health MEC, Dr. Noma French Mbombo, arriving here, taking part in this rollout plan. Of course, the President is expected to arrive here anytime, and he will be taking the jab right here from Khayelitsha.
To arrive here anytime, and he will be.
A moment, I suppose, that takes South Africa into trying to figure out where to from here. Mass inoculation is now going to be the order of the day. Yes, health workers get the first set of jabs, then of course, and considering the amount of hysteria as well as issues that have really plagued the rollout of these vaccines, not just Johnson & Johnson, I mean before this, AstraZeneca, of course, and those issues. To get this to this point then must clearly be, for health workers, a slight relief then as well, considering that they've had to deal with quite a lot. I know you were speaking to health workers a little bit earlier, Bulelani. How do they feel about this moment too?
Western Cape and Cape Town that will be having this. This is going to be a whole nationwide rollout plan, and of course what we do know is that the country is preparing itself for this very, very, very crucial time in our history of modern day world. And what we do expect, of course, is that the country, as it quickly rolls out the plan, is going to reduce the number of infections, reduce the number of deaths that are recorded on a daily basis. And the President, in his own view, by leading by example, showing confidence in the vaccine, and is going to do this public display to ensure that even the most skeptic critics that have been anti the vaccine are going to see that even the country's #1 citizen is actually giving confidence in this vaccine.
Even the country's #1 citizen is actually giving confidence in this vaccine.
Yeah, Bulelani, stand by then. We also do have our foreign editor here at the SABC, Sophie Mokoena, joining us then as we get to grips with all of this. Sophie, it's certainly a big step forward for South Africa in a time like this, right? 328 days since the first lockdown here in South Africa in what was late March. This is hopefully a step in the right direction.
Yes, when you look at those visuals, I hope our colleagues will bring those visuals. Let's sit on those visuals because these are historic visuals. Vaccination has started. We see those frontline workers. I think this is the fourth person to take a vaccine. The Minister of Health is there, and we expect the President to come in any moment from now. But I think these are historic visuals. Perhaps 100 years on, when we talk about the COVID-19 pandemic, this will be part of history, and it has been documented today that South Africa did participate in the process of ensuring that the world is able to fight this COVID-19 pandemic that has caused a serious damage to the entire world. You can see there the health workers are clapping hands as their colleague is receiving this vaccine, and I think in many other parts of the country we'll see this kind of visuals. But take a look. I mean, you can see the minister is there looking, and of course, health workers, she's done now. She's moving away. Another person will be coming in soon. And I think this is the fourth person to receive a vaccine. We started earlier on. We saw a first lady, a health worker coming in, and then it was a gentleman, and now we're seeing another person walking towards the area for her or him to receive that vaccine. And I think this is the Johnson & Johnson vaccine. It arrived last night from Belgium. It is a one dose. It was approved by the regulator in South Africa. The intention was to ensure that South Africa doesn't miss the deadline to vaccinate its frontline health workers after there was a challenge with the AstraZeneca a week ago. And I think relief for the minister, but there are still lots and lots of challenges, because when you look at the dose is 80,000. It's a drop in the ocean. We earlier on had 1 million from AstraZeneca. That was much better, but 80,000, it's nothing. And therefore, government will have to work with speed to procure other doses from other pharmaceutical companies. And I think at some point in time, even the AstraZeneca will be used in South Africa as soon as the concerns around efficacy, particularly on the 501YV2 variant, has been resolved. But we know that the World Health Organization has indicated that AstraZeneca can be used. That is why South Africa has taken a decision to donate those 1 million doses to other African countries where they don't have a problem of the 501YV2 variant. It is happening, and I think now South Africa is among those countries who have started with vaccination. We know that we were told the president will take the vaccine. The reason being to instill or to encourage South Africans to have confidence in the vaccine. It is not because he is doing this for himself, but like it has happened in the United States of America, where we saw Joe Biden, the president of the United States of America, and Kamala Harris taking the shots, demonstrating the efficacy and saying, if we can take it, we can all take it. But of course, it is not compulsory. It is up to people to decide. But you can see the work has started. It's up to people to decide, but you can see the work has started.
The importance thereof, though, is clearly shown in just how historic even this moment is there, as you see even the health minister, of course, looking to get involved in that. Thank you so much for that, Sophie. Do stand by as well for us. On the line, we do have Professor Alex van der Heever from Wits School of Governance as well. Let's talk very quickly, though, Prof. Alex, if you don't mind. Just really, these vaccines are said to cost the country quite a bit in the long run, right? I mean, that's the big issue that we've had at play here. Is that really the case, though? Is it going to cost us an arm and a leg to try and inoculate this country and get herd immunity as much as possible? Not really sure if the professor can actually hear me there. Professor Alex van den here from Wits School of Governance. Just wondering if you can hear me. We're talking just very quickly about the cost. Will we truly pay an arm and a leg for this?
No, the vaccines are very affordable. From a fiscal perspective when we consider the impact of the epidemic without any vaccine. Last year, we already lost around about 350 billion rand to 400 billion rand of our economy because of COVID. So the vaccine strategy is critical to ending the economic and social catastrophe that we've been experiencing. So the direct costs are actually quite trivial in comparison.
Yeah. How important and significant then is this moment in terms of a recovery, not just economically, but just as the globe, really, just trying to find some sort of lack of fear, or perhaps no longer fearing, that things are going to go from bad to worse here. How important is this in recovering as a globe when vaccinations are beginning to come through?
We are basically seeing the light at the end of the tunnel, but we've still got a way to go. This is our sort of critical route out of this pandemic. But a lot will depend on the pace of vaccination and the extent to which we vaccinate the globe as a whole and not just a few countries. To the extent that the vaccine remains prevalent in many societies, the risk of new variants emerging will continue, and those variants themselves may impact on people who've been vaccinated. So part of actually getting ahead of the virus is making sure that we get as many people vaccinated as fast as possible with vaccines that work against the current range of variants before they mutate.
The requirement then for mass inoculation to reach that sort of herd immunity, has that changed at all? Is that still the status quo that really does need to be followed in order to try and get as safe as possible as a country?
Yes, we have to have as complete a level of vaccination as possible over time. It's a question as to how long we will take to get there. But certainly if we've at least vaccinated the high-risk groups, we will have eliminated the severity of the disease on large parts of the population. But that will not introduce herd immunity. So we do have to vaccinate a lot of the people who will probably only develop mild illness as a way of making sure that we don't have people left who are capable of transmitting the virus and also keeping the virus kind of prevalent within the community, which aids its mutation over time. So herd immunity is critical. The question is really when we will achieve that level, including catering for variants and reinfections.
Sure. It's so many permutations at play here that really do need to be dealt with. But really appreciate the time, though, Professor Alex van den Heever there from Wits School of Governance joining us, as of course we continue to unpack this really critical and important moment for South Africa as we finally get those jabs going, right? That's the 80,000 doses of the Johnson & Johnson vaccine, which arrived just yesterday. Of course, the inoculations beginning in earnest here in South Africa as we begin to hopefully begin our recovery. Yes, it will be a slow start and it will be a slow process also. Let's consider that we've only received 80,000 for a country that has more than 50-odd million people. So this is just the start. Yes, the health workers do need to get inoculated to begin with. And then from there, we move on to more critical and elderly, and then we get the mass population as well. So it is going to be a huge and long and big effort, not just from health workers, not just from government, but from you and I as well. If we choose to take the vaccine, then obviously we need to play our part as well in ensuring that we remain safe. So whether you take it or not, the critical element here still remains. Remain safe with a safe social distance, wearing your mask as well, while also hand washing and sanitizing. Very critical and important too. So that still remains the case. That hasn't changed. And while we're watching all these visuals as well, as you can see, we're still critically trying to understand the mutations of the virus, the changes that may happen in future, just how the world begins to cooperate, how things will get better in time, of course, is fully dependent then on what happens in this first phase. Many will need to, of course, begin to understand the virus a whole lot better. 328 days out from our first lockdown. Of course, the virus has been in circulation perhaps since 2019, late 2019, so even longer than the 328 days that we've put forward, and yet the full understanding of this virus is still not known entirely. It is stumping even the most intelligent of scientists, if you want to call it that as well. The epidemiology segment of the world is certainly trying to find one way or other, indeed, to move forward with this. A reminder as well that you don't have to take the inoculation. It isn't compulsory, but of course, it does help certainly in the cause and in the case of ensuring that less and less people are infected and hopefully no more fatalities. We are getting word then that President Cyril Ramaphosa has indeed arrived in Khayelitsha, where those vaccinations are indeed taking place at present then here in that hospital that we're currently showing you visuals of there. And we can hopefully give you live visuals of that when he does indeed step into the hospital. Of course, unfortunately, nobody but the camera people are allowed in that room right there then, and it does give you a sense then of how important and significant it is that we ensure that not just social distancing, but that things are followed through in the right procedure. As you can see, we are indeed just waiting there for President Cyril Ramaphosa to step through. We've already seen Health Minister Dr. Zweli Mkhize as well be part of that process, where some health workers were indeed getting the first jabs then as well of the vaccination. How critical and important this will be in the fight against this horrible, horrible pandemic that has taken millions of lives across the globe. Millions and millions of people passing away, unfortunately, as well. We also trying to continue to ensure that we get less and less done in terms of negative news coming out with regards to this pandemic. Let's continue to talk just a little bit more about this virus and really just how important this inoculation process really is. Dr. Nisha Jacob from the Center for Infectious Diseases, Epidemiology and Research at the University of Cape Town also joins us now. Dr. Jacob, thank you so much for the time. Really appreciated. A historic moment, and one can say, even though it's going to be a slow process, this is the start of our recovery, we hope. Is it?
Absolutely, a really significant milestone and really a symbol of hope for the country and really something that we can really be proud of, that we've come to this moment, and it really is an element of hope for our many healthcare workers as a start and for the pandemic as a whole. So definitely a significant milestone.
How much relief do you think comes to people like health workers, like yourselves particularly, when you begin to start seeing progress like this being made? I mean, for the longest time now, for close on a year, you've had to be dealing with deaths, with people who you sort of are just hoping will heal in many ways. You just provide oxygen as much as possible. There's very little you could actually do. And now there's finally something that can be done to preempt, to prevent, to ensure that it doesn't happen again in future.
Absolutely. So healthcare workers have really they've been at the front line and been having the first-hand experience of immense suffering at different levels. And this really, the whole period has been one of great uncertainty as to never knowing when it will all come to an end. And the vaccination actually offers some hope that there is light at the end of the tunnel, bearing in mind that it will take some time before we can effectively stop the spread of the virus. But definitely this is a start. And the reason the Sisonke program is specifically targeting the...
Yeah. Dr. Jacob, if you don't mind, I'm going to just interrupt you there. My apologies on that. The President Cyril Ramaphosa, has actually just walked into the hospital room there that we are, of course, following proceedings. Please do stand by for us. We apologize to cut you off there, Dr. Jacob, but really just to note that significant moment, right? President Cyril Ramaphosa also being a part of this, indeed, trying to ensure and assure South Africans that the process has begun. The notion of trying to move South Africa forward, trying to get out of this mire of the COVID-19 pandemic, which has plagued the country, has seen everything from alcohol to tobacco bans to the timelines and changes with regards to curfews and the like as well, just what people can and cannot do. No normality. And people have learned to adapt. And I suppose President Cyril Ramaphosa being given somewhat of a firmer understanding of not just how the vaccine works, but what exactly is required to know before you take the vaccine as well. And we are expecting him to also take the vaccine at some stage as well. That jab is said to be taken by the president there, Cyril Ramaphosa. As we noted, it is the Johnson & Johnson vaccine that he is taking. The AstraZeneca vaccine, which was brought to South Africa earlier this month, will then be sent off to the rest of the African Union at no cost to the fiscus, which of course is quite critical as well for an economy like ours, which has continued to struggle with high debt as well. So President Cyril Ramaphosa, as you can see there, being briefed as well as he arrives at the hospital with onlookers there, the healthcare professionals, as well as Health Minister Dr. Zweli Mkhize there. Of course, Foreign Editor Sophie Mukwena also still standing by. There's the president there as well. So very important, isn't it?
Indeed, very important. You can see that the health worker is assisting the president. He is currently filling the form to ensure that he is documented in terms of people who have received the vaccines, because you have to keep this information and also do follow up, because sometimes people are experiencing the after effects, you know, like any medication or any vaccine. You would recall when we were still learners at school, when we received the vaccines, there were some effects and sometimes you wouldn't even be able to go to school. Therefore, the medical team of the president, because he's got a medical team, they will then monitor progress and to ensure that they are aware how he is responding to the vaccine. And this is going to happen to all people who are going to receive the vaccines. They are going to keep records so that they can do follow-ups, particularly with vaccines where you have you take a first dose and a second dose. They will keep track so that they can do follow-up to ensure that you go for your second dose. But in this case, it is a Johnson & Johnson vaccine. You don't need a second dose, and therefore the president will just take this Johnson & Johnson vaccine. There is the president, and health workers are currently helping him, and very soon we will see a health worker administering that vaccine.
Yeah, Sophie, thank you so much for that. As you can see there, the rolling up of the president's arm there as we get ready to get that jab into his shoulder. Then President Cyril Ramaphosa said to receive that vaccination there for COVID-19. It is a Johnson & Johnson jab. Indeed, a jovial president there. It's been a long wait. It has been an onslaught, a big struggle, and certainly a difficult time then for the country as well, as we continue to try and find a way to forge through there as he is now set to receive a jab there, the president there. And as you can see, there it goes, the President Cyril Ramaphosa getting vaccinated for COVID-19. And We continue, of course, to follow through. We of course continue to follow through these images as things continue to come through. As we noted, then there is 80,000 doses of the Johnson & Johnson vaccine that was received. Then 17 vaccination centers have been identified, particularly for the rollout of this vaccination in the Eastern Cape. The likes of Livingston Hospital in Port Elizabeth, as well as Nelson Mandela Academic Hospital in Mthatha, is set to receive the Johnson & Johnson vaccine, or is part of the vaccination centers. As we see the President Cyril Ramaphosa there walking out, of course, and thanking the healthcare workers, having just received his inoculation jab there for COVID-19. Some of the other vaccination centers, as I said, 17 of them around the country. The Free State Pelonomi Hospital in Bloemfontein, as well as Universitas Hospital in Bloemfontein, will also be a vaccination center. We'll also, in Gauteng, we'll have the Chris Hani Baragwanath Hospital in Soweto, as well as the Steve Biko Academic Hospital in Pretoria, will indeed get or become vaccination centers. KwaZulu-Natal will have Inkosi Albert Luthuli Central Hospital in Durban and Prince Mshiyeni Memorial Hospital in Umlazi indeed get the inoculations as well, and the jabs will certainly be sent to them, and they'll have be part of the vaccination centers. Of course, the hope here is that a whole lot more of the Johnson & Johnson vaccines, or perhaps others that are deemed sufficient for South Africa and the variant indeed found in the country, we will find the vaccinations sufficient to help South Africa curb the virus and its spread any further. As I noted, still with regards to the 17 vaccination centers, you go to Limpopo, where the Pietersburg Hospital in Polokwane, as well as Mankweng Hospital in Polokwane, will also be receiving jabs as well. There we have the Health Minister, Dr. Zweli Mkhize, also set to receive his inoculation there for COVID-19. Quite critical, of course. We do know that the Health Minister did get COVID-19 as well. So it will be interesting to also just see how this plays out and what exactly works and doesn't work, how it works, how efficient. Of course, the efficacy has certainly been quite important of late. Dr. Zweli Mkhize, the Health Minister of the country, certainly getting that jab there as well. So very important to see that change, to see that progress being put forward there. We are, of course, in the Western Cape in Khayelitsha, to be exact. That this is where the first jabs of the COVID-19 vaccination are indeed taking place, and we are covering that for you live. If we stay in the Western Cape, some of the other vaccination centers in and around the area, the Groote Schuur Hospital as well as the Tygerberg Hospital, both in Cape Town, will both also be vaccination centers for the country. In Mpumalanga, we have the Rob Ferreira Hospital in Nelspruit and the Witbank Hospital in Emalahleni. There you have it then, the Health Minister getting his jab as well. Still, of course, with the masks on, as much sanitizing as possible. And South Africa hopefully begins its road forward then in the fight against COVID-19. General practitioners, as we've noted, have certainly been very critical and important to how the inoculations take place, what exactly happens for the country. The visuals, I suppose, speak for themselves, but the healthcare workers, the frontline workers, people who will certainly be taking care of the country for the most part moving forward, will certainly be the ones who take the jabs first and will be looked at to really take South Africa's fight a whole lot more strenuously forward as we try to continue this fight against COVID-19. Difficult, the process has taken long, but indeed here we are. We're finally getting those inoculations happening there as well. President Cyril Ramaphosa, as we saw a little earlier, taking the inoculation. Dr. Mkhize as well getting those jabs too. All right, very important and significant moments there, as we noted, the healthcare workers, and you can see also critically an EMS worker as well. They're getting a jab too for COVID-19. We're hoping to get a sense of just how many people will be inoculated today and how the process sort of moves on from here. What happens after this 80,000? Do we begin to receive more Johnson & Johnson vaccinations, or is this sort of the end for now? And what happens? Of course, more than 1 million healthcare workers across South Africa need to be vaccinated before we move on to part 2 of the inoculation process, where critical workers, South Africans with, of course, with some other diseases as well, and infections that they may face critically, will also have to be inoculated. Healthcare workers, a further 200,000 more doses has indeed been promised, so we are indeed waiting for those, and whether those will come to the fore and just how quickly that will happen will change and will determine just what happens with regards to the spread of COVID-19 in South Africa. Of course, the less it spreads, the better. That is all we're looking to try and get to. Of course, having seen that 1 million AstraZeneca vaccine doses, unfortunately, not work for us. All right, then we're going to continue then, of course, to try and get some more guests then as well for you to try and unpack this a little bit more and try to give you a sense of where and how important a moment this really is in the big scheme of things. Professor Landon Meyer is the director and head of the School of Public Health and Family Medicine at the University of Cape Town. Professor Meyer, thank you so much for your time as well this afternoon. Just tell us in your words just how critical and important this moment is. How much relief comes to you when you see these inoculations?
Yeah, I thank you for the invitation to be here. This is, from my perspective, a monument. Moved from the start of the epidemic to having an efficacious vaccine available today and being rolled out to the general public. Really feat both of scientific achievement, but also public health responsiveness, and I think South Africa can be deeply.
Professor Meyer, just struggling with your line a little bit there. I think it's actually Professor Meyer, my apologies. Professor Meyer, we are struggling just a little bit with the line. It does seem to be crackling, so hopefully we can really just get back to you and speak really directly about the impact this will have just on the medical profession and just how significant it is that something like this now happens, healthcare professionals being looked after to be the first ones to get inoculated, and the process sort of moving on from here. Does this create a sense of encouragement? I mean, confidence perhaps lifted a little bit within the medical profession as well, having seen this come to the fore?
Absolutely. I think it really to public sector healthcare workers in our country, of government to protecting our frontline healthcare workers. The role that these frontline healthcare workers play, it's not just a response to COVID-19.
Yeah, we're just seeing the president there, President Cyril Ramaphosa, exiting the area there. Then, of course, that is where the inoculations are indeed taking place. So we're just seeing him exit, of course, having just had his jab as well. Another EMS worker, as we noted earlier, saying that they are getting the jabs right now. So really significant and important moments. I suppose what will be even more important is the first inoculations of the general population, because that is where the real recovery is then, Professor Meyer, isn't it?
Yeah, I think so. I think it's the next step. Right, prioritizing frontline workers with, and in the future phases when we get to, I think that's when we'll really start to see the impact of vaccine.
Yeah, so unfortunately we're struggling just a little bit with the visuals. Professor Meyer, even your line as well, also a bit of a struggle there, unfortunately. So we'll try and get some clarity and clear things up as well there with regards to that, and hopefully get a sense and a word perhaps. My colleague Bulelani Philip is indeed in Khayelitsha as well, continuing to follow this one for us as well. So hopefully we'll get to cross to him there, seeing the president depart the scene, if we want to call it that as well. Let's go straight to my colleague Bulelani. The sense then, do you feel a sense of optimism? Is there a sense of jovial nature outside there of the hospital as the president gets his jab as well and now begins perhaps to exit and thank all of those around? Not sure if we're getting my colleague Bulelani Philip, who is out in Khayelitsha following this story then for us. So unfortunately, right now, not getting through to him. But very interesting then. Of course, we've seen now of late the politics get involved at a time like this, where you've seen the likes of the EFF say they want the process with regards to the procurement of these vaccines to be made public in order to avoid any form of corruption that they feel they have seen as well with regards to the purchase of public of protection equipment as well there. As you can note, just outside then the hospital in Khayelitsha there, as you note, the president indeed taking a little bit of a walkabout and perhaps thanking staff as well, thanking all those around to try and give thanks to them. My colleague Bulelani Philip standing by with this one as well. Bulelani, perhaps sentiment and words to be said then from the president. We are expecting a few words from him, aren't we?
We have about 5 minutes. President actually to Parliament. Thanks for coming.
I'm not sure if my colleague can actually hear me there, Bulelani Philip. As you can see, still a bit ready there as well. We are expecting perhaps a few words from President Cyril Ramaphosa and the Health Minister there, Dr. Zweli Mkhize, as well as the Health MEC in the Western Cape region. That's Noma French Mbombo as well, being part of the entire contingent there, of course, when it comes to the first inoculations to indeed come through for South Africa, having received the 80,000 jabs. Hopefully we can get some word from them there. Let's listen in.
Dr. Mbombo, the head of department, Dr. Klute, and all the other senior officials, and Deputy Minister Zizi Kodwa, members of the media. At this point, we just want to introduce the president, who has just gone through the vaccination with the COVID-19 vaccine prepared by Johnson & Johnson. At this point, therefore, I'd like to invite the president to share his experience over this very special day for us. So I'll hand over to you, Mr. President.
Thank you, Minister. Thank you, Dr. Mkhize, MEC Dr. Mbombo, and the head of the department. I've just had my vaccination. And I must say that at first I was a bit terrified of this long needle that was going to be embedded into my arm. But it happened so quickly, so easily. It was just a prick on my flesh, and I really did not feel much pain. This day represents a real milestone for us as South Africans, that finally the vaccines are here and they are being administered. And I was rather pleased that there were 5 people who were vaccinated before me, and they are health workers, and it was a joy to watch them to see whether anything had happened to them, and gladly nothing had happened to them. And it means that being vaccinated is a fairly straightforward process. And I'd like to invite South Africans to take this up so that we can all be safe, we can all be healthy. But I also want to thank the Minister for having worked so hard. Minister Mkhize spent sleepless nights making sure that the change from the earlier vaccines that we had acquired, which proved not to be so effective against the variant we have, happened so quickly and so smoothly. I can tell you that he spent sleepless nights, sending me text messages almost every hour. And it was a joy to finally get his text message that President, the plane has now left Brussels, and he showed me the photograph of the plane as it was being loaded, and every step of the way. So I'm really glad, and he's been so focused, he's been working so hard, and thank you, Minister. And MEC, Dr. Mbombo, would like to thank you too. I did say that our provinces are really ready for the vaccination process, and I was glad to see that they've trained people. There are many people who were trained here. They were earlier trained for the AstraZeneca vaccine, and they had to change very fast to start training people for the Johnson & Johnson vaccine. Now it does so that our health system is robust, it's agile, it's effective, and our health workers are able to get up to speed very, very quickly. And I saw a real army of our health workers, all knowledgeable about what we are now doing. Now this is really a milestone, as I said, for our country, and we are going to be rolling out this vaccine throughout the country. It's already started in a number of health centers, and I think it's going to be flawless. I think it's going to be done effectively, and as we get more and more of these vaccines, as the Minister brings them in, I think we will be able to vaccinate up to the 40 million South Africans that we should. So this is a new era for us, and an era that will mean that, yes, we restore the health of our nation, and we do so with our health system, or through our health system that is robust, that is gaining strength on an ongoing basis. And I'd like to say to all the doomsayers who've been, preaching that there's going to be total mayhem and disaster, I think let's all have hope and faith in our system, in our health workers, and let's give them an opportunity to do what they do best, because they know how these vaccination processes are going to unfold. As for us in government, we will continue to give them the support and the help and all the assistance that we are going to be able to give them. So I'd like to thank you all for being here, and I'd like to thank the staff for having treated me well as well, and I'm hoping that they will be able to treat every South African who will walk through these doors as well as they treated me. So you will make sure that it happens. Yes. Thank you very much, MEC. Thank you very much, Minister. Okay, thank you. Thank you. So I have to go to Parliament. I'll leave the Minister here because at 2 o'clock I'm going to be listening to the reply to the State of the Nation address. So the Minister, who knows everything about all these things, will answer all your questions. Thank you very much.
Thank you, Mr. President. Thank you for the support and the leadership. Thank you for being here. And really thank you for taking the chair. Thank you. We now wait for the questions. Thank you very much.
Thank you so much.
Who's going to help us coordinate?
I will, Minister. I will coordinate, but I'm going to take all of them. Thank you.
Okay. Thank you. I'm just now coordinating the questions to the Minister whilst the Minister is here.
and also even from the team, if need be, Professor Glenda Gray and also Professor Becker, who are part of the implementation study. They are also here. So, and also for our side, the coordinators for the whole of this, Dr. Karim and your team with Dr. Krish Vallabhji and also Ms. Juanita Arens, who are also the overall for the sites in regard to that space. So I see, and let's start this side. We start with the Melbourne, News 24, ENCA, M3, RT4, we take 5. Okay, take 4. Melbourne?
My name is Martin Charles from Clinic 4. I just wanted to find out, how do you feel about the fact that this has been rolled out here in Khayelitsha, and also the fact that some organizations have raised questions about when refugees fit into this criteria, will they be able to also be part of the vaccine rollout? What is your response to that?
Let's do all of them, okay? Aisha?
Good afternoon, Minister. I'm Aisha Ismail from ENCA. I'd like to ask you, when that aircraft landed last night with the Johnson & Johnson vaccine, what was the first thing that went through your mind, and how did you feel?
Afternoon, Minister. It's Christian Du Plessis here from Netwerk 24. Minister, I would firstly like to ask you whether you yourself have also been vaccinated, and secondly, COVAX is finalizing its arrangements for shipment. Have you managed to convince them not to send another vaccine other than the AstraZeneca vaccine? And then lastly, are we still considering giving away the 1 million doses of the AstraZeneca vaccine to the African Union? Or how sure can there be that there will be an alternative for people to be vaccinated by another vaccine? Thank you.
The last one, newsroom.
Atim Jana from Newsroom Africa. I have got not a few questions, but just two questions. One is around who will be vaccinated, and as far as the cabinet is concerned, have you been vaccinated? The president has been vaccinated. We understand that this first phase is for healthcare workers, but will government leaders, particularly in the cabinet, get vaccinated, and when will they get vaccinated? The second question then is, what is the situation in other provinces? The Western Cape, we've seen the president getting vaccinated. Is the same kind of treatment been given in other provinces where they're ensuring that healthcare workers are getting vaccinated as well?
Yeah. Thank you. Minister?
Thank you very much.
Switch that one off.
Speak to that one off. There you go.
Thank you very much for the questions. Firstly, thank you for your interest in covering a very important milestone in our fight against COVID-19. I will start by thanking President Cyril Ramaphosa for his leadership and for his support, and I want to thank him for breaking his schedule and come over to take the first vaccination, and therefore making it clear to all South Africans that we are determined to save our health workers and also making it clear that we're all determined to make sure that South Africans are protected from this pandemic. Having been here already must give hope and encouragement to all our people that at least we now have a possibility of defeating COVID-19. I want to thank the team. On my right here we have professors led by Professor Glenda Gray from MRC, who have done a lot of work with us as a ministry. I also want to thank the Director General, Dr. Buthelezi, from the National Department of Health, for all the work that has been done. It's a whole team effort behind the scenes. They have not slept a wink they have worked so hard to make sure that this works. I think all of us are aware that we were put in a situation where we were to deal with Plan B, which meant that we were to change from what we originally planned when we got surprising results, and we thought we needed to create a bit of space so that we are able to check what's happening insofar as the one Caulfield vaccine was concerned. So I want to say thank you, MRC, Professor Gray, and the whole team, as well as Dr. Mtelezi for all the work. I know they didn't sleep because I used to wake up in the middle of the night and call them and ask them what's happening, and they were actually always up there alert. And we've had lots of meetings with the manufacturers. Even they, we want to thank them because we actually got them out of their schedule. We actually pushed quite hard to say we need this, and they needed to move. They went beyond what is usual to actually make sure that we get the provision from South Africa. So I want to thank in particular the chief investigating what called ship scientist, Professor Paul Stoffels, Dr. Paul Stoffels, and his entire team for all the work that they've done. And I'm sure they would sit there and watch to see South Africa beginning to start the very, very important work of vaccinating our people. Having said so, I want to thank our health workers. Our health workers have persevered and endured anxiety, panic, the risk, the threat of getting the infection and infecting their families. And I want to say to them, we did say at the beginning that they are our frontline warriors. We need them protected. We need them encouraged. We need to make sure that they are the ones who are safe so that our country can be safe. Our country has been saved because of their dedication and our commitment and their hard work. And today we're saying we are now responding, and we're saying we're here to help, to make sure that the health workers are protected. So when we were going through all of this, of course, one was filled with a mixture of emotions. On the one side, it was a lot of excitement that this program was at last going to take off. And of course, it was quite an exciting moment, probably emotional moment when we got the message that the flight has landed. And as we have heard Professor Gray, they have been giving us, every so many miles of flight, they would actually say, this is where it is, this is where it is. So we tracked it from the first time it left the African soil, went to Brussels and back, and we wanted to know what was happening. So there was a lot of excitement from that point of view. And also I want to say that there was a sense of pride that we had our team. Everyone out there has been very helpful, wanting to assist us, and they've actually risen to the occasion to do everything that needed to be done to save the people of South Africa. And that, for me, filled me with a lot of pride. But at the same time, it was also a sense of pride that our own people, our health workers, will at long last be able to say, yes, I've got some degree of protection as I face this formidable pandemic ahead of us. But at the same time, we also had a sense of humility of how our people have actually waited for this moment to arrive, not giving up, persevering, facing on, dealing with the wave after wave of COVID-19, like soldiers in the war who would stand up and face the enemy, fight on, even though they lose their comrades, their colleagues, and then in the process, they would still wake up and continue. And for me to serve with such a formidable army of health workers, it has filled us with a lot of humility. And we want to say thank you to them all. And we also want to say to the members of our community that have lost their loved ones, their friends, their relatives, their comrades, their workmates, that to all of them, they have our sympathies. We owe a great debt of sympathy to them for the carnage that we have all gone through, the decimation that we have seen in terms of the numbers of people, particularly in the second wave, because it has been, completely unimaginable that you could lose so many people within such a short space of time, and that you could lose them in a way that the second wave had actually demonstrated a huge amount of unpredictability. I went and spoke to a number of doctors and some of them in intensive care units. And I said to them, what can we do? They said, you know, we are specialists in this field. We have done this, we enjoy it, we have saved so many lives, but this one wave has been a bit problematic. It's unpredictable. We do everything that we know needs to be done, and we suddenly find that the presentation of the illness is very different, and therefore we don't quite know what's going to happen. So I want to therefore indicate that it's been a very, very grueling fight that our health workers have gone through. Having said so, then I want to then say we are here where we are now. This is the beginning of a new era, as the President has indicated. We have today distributed throughout the whole country 80,000 doses of our vaccine, and this 80,000 is spread to over 32 sites throughout the country, and those sites are largely the sites which are Medical Research Council sites combined with those of the Health Department who are managing the rest of the program. We're expecting between now and the end of about 4 weeks, we should at least be able to reach about 500,000 doses that we should be able to receive. And in that process, they will be coming in waves, and week by week, we should be getting additional doses. And out of that process, we will actually be vaccinating at the same time running an implementation study. That study is basically to say, once people have been given the vaccine, we are watching how there might be any breakthrough infections, particularly as people are working in a high infection area. And for that reason, we're going to continue the observations amongst all of those who will be vaccinated. We are anticipating also that there will be additional doses that will come from Pfizer, and within the next month there will be a number of those that will be coming through. Initially, we actually are expecting about 500,000 of those doses. So when they come, we'll simply continue with the vaccination, which in fact means that we will have vaccinated the first 500,000 if we are able to deal with that, and then of course the next 500,000, all of those will be the first doses. We have learned from research that you can do one dose, and then between 3 and 4 weeks, or up to even 6 weeks, we're still safe to go. But we've actually learned from the UK that we can actually wait for 3 months, which means we can actually vaccinate a large number of people within the period, so that everyone gets the initial protection, and thereafter will then come with the second doses. We are expecting that by June we have a commitment from Pfizer of about 7 million doses that should be coming here. And I must indicate that this is all because we've actually asked for consideration for South Africa being an epicenter in the continent, and the fact that with the raging second wave that we've gone through, we then asked to change all the plans that they had. So we are there to renegotiate all of them. We will announce all of those dosages or those vaccine numbers once we have finalized all the agreements, and they are very close to being concluded now. And so we will give you a sense. But all I can tell you is that as we sit now, we've actually got enough doses in the discussion, in the pipeline, to cover all South Africans as based on the number of 40 million that we had spoken about. We will only give you the details once all of that has been done. I can just say to you, we are not at all anxious that we might run into problem with our vaccine program. So of course the questions that have now been raised, we have responded to the aspect of how we've been all feeling. I want to also say thank you to all the provinces. They've all prepared.
All right, so we've lost transmission there. Good afternoon. It's 2 p.m. Central African time on day 328 of the lockdown here in South Africa. You're watching On Point, coming to you live from our Auckland Park studios. Of course, I'm Nompumela Losiziba in the headlines this hour. Okay, we are going to go